Kimberly C. BATOHANON from BSN3 Leininger, and I'm going to perform
Vital Signs Assessment.
Step number 1. Wash your hands.
Step number 2. Prepare all required equipment. Organization facilitate accurate skill performance. Step number 3. Explain the purpose and the procedure, providing information and factors.
Close doors or use a screen. Maintains client privacy and minimize embarrassment. Step number 5. Clean the thermometer with rubbing alcohol before use. Wipe the area where few organisms are present to the area where more organisms are present to limit the spread of infection. Step number 6. Assist the client to a supine or sitting position. Step number 7. Move clothing away from shoulder and arm to expose axilla for correct thermometer bulb placement. Step number 8. Be sure client's axilla is dry. If it is moist, pat it dry gently before inserting the thermometer. Step number 9. Press the button to turn on the digital thermometer. Step number 10. Insert the bulb of the thermometer under the arm, fully into the armpit so that it is contact with the skin. Step number 11. Keep the arm flexed across the chest, close to the side of the body. Step number 12. Remain still and wait for the thermometer beep to signal it is finished. After the beep, promptly remove the thermometer to get the right and proper result as the equipment thermo evaluates the heat it indicates.
Step number 13. Wipe the thermometer from the steam to bulb with alcohol to prevent the spread of infection. Step number 14. Explain the result and instruct her if she has a fever or hypothermia to share his data and provide care needed immediately. Step number 15. Wash your hands to prevent the spread of infection. Step number 16. Record the client's result. Documentation provides ongoing data collection. Step number 1. Wash hands. Hand washing prevents the spread of infection. Step number 2. Explain the procedure and purpose to the client, providing information foster cooperation and understanding. Step number 3. Assist the client in assuming a supine or sitting position to provide easy access to pole sites. Placing the client's forearm on the armrest of the chair, putting on fingertips over radial pulse. Step number 4. Count and examine the pulse. Place the tips of your finger index and third finger over client's radial artery. Apply only enough pressure to radial pulse. Using watch, count the pulse beats for a full minute. Step number 5. Record the rate on the client's chart. Documentation provides ongoing data collection. Step number 6. Wash your hands. Hand washing prevents the spread of infection. Step number 1. Make client's position comfortable, preferable sitting or lying. To ensure a clear view of the chest wall and abdominal movements. Step number 2. Prepare count respiration by keeping your hand fingertips at the client pulse. Step number 3. Counting respiration. First, observe the rise and fall of clients. One full cycle consists of inspiration and expiration. Count respiration for 1 full minute. Allow sufficient time to assess respiration. Step number 4. Perform hand hygiene to prevent the spread of infection.
Step number 1. Wash your hands. Hand washing prevents the spread of infection. Step number 2. Gather all equipment. Organization facilitate performance of the skill. Cleanse the stethoscope, earpieces, and diaphragm with a spirit of swab wipe. Cleansing the stethoscope prevents the spread of infection. Step number 3. Have the client rest at least 5 minutes before measurement. Helps to avoid falsely evaluate readings. Step number 4. Assist the client to a comfortable position. Be sure room is warm, quiet, and relaxing. The physical and interpersonal environment is stressful, affect the blood pressure measurement. Step number 5. Remove any constrictive clothing. not constricted by clothing, is allowed to access the brachial pulse easily and measure accurately.
Step number 6. Center the calf bladder approximately 2 to 5 cm above the site where you palpated the brachial pulse. Center the bladder to ensure even calf inflation over the brachial artery. Step number 7. Wrap the calf snuggling around the client's arm and secure the end approximately. Losing fitting calf causes false high readings. Palpate brachial pulse distal to the calf with fingertips of non-dominant hand. Step number 9. Close the screw clamp on the bulb. Step number 10. Inflate the calf while still checking the pulse with other hand. Step number 11. Observe the point where the pulse is no longer palpable. Step number 12. Inflate calf and pressure 20 to 30 mmHg above the point pulse disappears. Step number 13. Open the screw clamp, deflate the calf fully, and wait 30 seconds. Step number 14. Position stethoscope earpieces comfortably in your ears. Earpieces should follow angle of the ear canal to facilitate hearing. Step number 15. Place the diaphragm over client's brachial artery. Proper stethoscope placement ensures optimal sound reception. Step number 16. Close screw clamp on the bulb and inflate the calf to a pressure 30 mmHg above the point where the pulse had disappeared. Step number 17. Open the clamp and allow the arterial dial flow rate 2 to 3 mmHg per seconds. Step number 18. Note the point on the dial when the first clear sound is heard. Step number 19. Continue deflating the calf and note the point where the sound disappears. Listen to 10 to 20 mmHg after the last sound. Step number 20. Release any remaining air quick in the calf and remove it. Step number 21. If you must recheck the reading of any reason, allow a 1-minute interval before taking blood pressure again. Step number 22. Assist the client to a comfortable position. Advise the client of the reading. Step number 23. Wash your hands. Hand washing prevents the spread of infection. Step number 24. Return instruments to their proper place and discard to prepare for the next procedure.